So, to start, would you mind giving us some insight into your diagnosis and your journey?
Sure. In April of 2016, I ended up in the hospital with a bowel obstruction that would not resolve in the small intestine. And I had been probably for more than 2 years trying to figure out what was wrong with me. I had been having these episodes, which in hindsight, then I learned were bowel obstructions. And, I'd be really, really sick at home and I'd have, horrendous vomiting. And then I'd just get better and nobody could figure out what was wrong with me. Every few months, and then the frequency got more and more. And I ended up in the hospital in April of 2016 in the small hospital in Bar Harbor, Maine. It's called Mount Desert Island Hospital. It's 25-bed hospital. My husband took me there. Actually, I went by, I went by ambulance a time frequent before, but my husband took me there and I was admitted to the hospital and the bowel obstruction just wasn't going to resolve on its own. So I ended up having to have a surgery. And so when I went in for the surgery, came out from the surgery, the surgeon came to see me and he said, "I don't think this is anything," he said, "but we found these two small nodules on the outside of your small intestine." He said, "They shouldn't have been there," and I sent him away for pathology, but I don't really think it's anything for you to be concerned about. Nah, I'd say a week to 10 days went by, and he called me on the phone, and he said that it was ovarian cancer, a spread of ovarian cancer of the small intestine. I had cervical cancer in 1990 when I was 30 years old. So I'd been through cancer before. I had had radiation treatment at that time. And so this was fast forward 26 years after my first cancer. So I was now 56 years old. And so, I didn't really think all that much of it until I started Googling and looking online and reading about ovarian cancer and the poor prognosis and the poor outcome for ovarian cancer patients. And that was a very different thing than my first cancer. In rural Maine, Maine's a really big state, geographically speaking, but not population wise. So in rural Maine, the only GYN oncology group in the state is located down outside of Portland in a little area, an area called Scarborough, but it's basically a suburb of Portland, Maine. So I went down to Portland to see a GYN oncologist, and I was told that I had stage 3B ovarian cancer, low-grade serous, and she recommended no further surgery because I had had so much pelvic radiation damage from my first cancer. My first cancer involved a hysterectomy at age 30, but they left the ovaries because I was only 30 at that time. That would have been in 1990. And my cancer at that point had spread to the lymph nodes, so I had radiation treatment, not chemo at that point. So the radiation treatment did a significant amount of damage in the pelvic area. And actually, I got 25 great years of life with no real problems until these bowel obstructions started happening, which were as a result of all this radiation damage from all these years. And I asked my question number this way. I said, "Can you give me an honest prognosis?" And I stressed the word honest twice because I wanted to know, because I would want to get my affairs in order, basically. And she said 5 years. 5 years, and that really correlated with all of the data that I was finding online. Less than 50% of people, women with ovarian cancer, survive more than 5 years, and then if you're stage 3 or stage 4, those statistics go even lower. And so I knew all that. I have a background in medical technology. I understand statistics and a lot about medicine, so I was a pretty informed patient anyway. So I started into the chemo. I had a lot of issues. I'm in a pretty good place right now. This month, April 2020, is my 4-year cancer anniversary at the end of the month. And, when I went to Dana-Farber, they said 5 years. Well, I don't believe that at all. I mean, that was based on the data that they had and my situation. I don't believe that is what will happen to me, because I think I'm doing really pretty good, all things considered. And so I think the letrozole, as much as it's been a hard drug, it's caused rapid bone density loss, things like that, and it's known for that. It's been a great drug. My body has responded really well. My cancer has responded really well to it, where a lot of women will start on the letrozole and, 3 months later, have another scan and their cancer is still growing. I'm not in that category. I'm in a very small minority, I think, of women that have really responded well to it. And And so it's a drug I need to stay on as much as I don't like it. And I haven't had a break from it in quite some time. I've just, stayed right with it. So I think, that's a long answer to your to your question about where I am and how I got here in the 4 years I've been here. I was in the hospital 5 times last year. I had multiple bowel obstructions, which are still a problem for me. I was admitted with AFib in January of last year, which came out of the blue. I have no cardiac history at all. It's one of the drugs. Is it from the chemo way back? It's a hard call. Just don't know. I have an amazing ability, I would say, to be knocked down and then to get back up and dust myself off and move forward in a good way. Each one of these hospitalizations takes a little bit out of you, and you never really recover 100%, I don't think. But I'm so very grateful to be doing as well as I am at this point. And I believe I believe that you have to have I call it a purposeful life. If you lead a purposeful life, you have something to get up in the morning for. Then you can kind of stuff the cancer down for periods and not let it consume your life. And where I know not everybody has the ability to do that, but I do. And it's for me, it's been the way that I've navigated these last 4 years, despite all of the negatives that have come my way. Sometimes it's frustrating, but you just keep moving forward.
Now, you mentioned your background in medical technology, as well as, having a purpose for when you get up. You are the director of the Millpond Health Center in Maine. How has, the current times we're in right now with the coronavirus pandemic, how has it affected the center and the services that you provide?
So the island that I live on is called Swans Island. It's about 6 miles off the coast from Bar Harbor, Acadia National Park area. We have a car ferry, a Maine State Ferry service that provides transportation back and forth for us to the mainland and back to the island. And so I've been out here since 2001, living here, moved up from Pennsylvania to the island. And we have a small health center. And so we have about 350 year-round residents, I would say. In the summer, we probably grow to about 1,000 or so. And 13 years ago, I was a part of taking an old restaurant that was on the island and completely gutting it and renovating it and putting a small health center in here. It's open part-time. We just don't have the population to be open full-time. And I've been really the sole employee from the day it opened. I did hire a part-time, a retired nurse practitioner that moved to the island. She's minimally part-time. I'm minimally part-time. She's not working now during this COVID-19 pandemic. I had spoken with her and said, I'm not going to be giving you any hours because there's no sense in both of us working and being exposed to patients. I'm willing to take that risk. And she has, grandchildren and other responsibilities that, I don't want to put her at risk. If I accept the risk for myself, that's one thing, but I don't want to accept the risk for someone else. I think she was grateful not to have to come to work during this time, to tell you the truth. So anyway, my job here is part-time, but I do a lot of social things. Like I have a women's group that meets on Monday every week. I do a Saturday coffee hour. We don't have any cafes or Starbucks or we don't even have a restaurant or anything like that out here. So the building is kind of a social center as well as a health center. And so I've canceled everything that is what I would consider a non-essential medical program. Not that those other programs aren't beneficial for people's mental health, especially in the winter, coming out of the winter too. But anything that's a non-essential program is gone by the wayside right now, hopefully to be resumed at some point later. And I've only kept the essential services. So I do a phlebotomy or blood draw clinic once a week on Tuesday mornings. So today happens to be a Tuesday. I had 8 patients come in this morning. And most of my patients that come in are seniors. I do have, children can come as well as young adults, whoever needs, but that's just the nature of medicine that most of the patients are older. So 8 patients came in this morning to have their blood drawn. And if they were not able to come here, they would have to get on the ferry. They would have to spend the money to go on the ferry. Our ferry schedule has been greatly reduced because of lack of ridership, because we're encouraged not to leave the island now because of COVID-19, unless it's, an emergency medically necessary to leave the island or for big grocery shopping. So people aren't going to the mainland right now. So my patients would have had to go to the mainland, spend the money for the ferry ticket. The schedule would have made them have to stay on the mainland for 5, 6, 7, 8 hours even before they could get a return trip back. And then they're going off for a 5-minute procedure. They would have come in contact with anywhere from 5 to 10 people or more, just strictly traveling to the mainland, where if they can come in the clinic here, they come in contact with me. That's it. My patients are pretty spaced out when they come here. Not spaced out in the mind. You could take that way. Their arrival times at the clinic are pretty spaced out so that they don't encounter their neighbors in the waiting room. I've given them some instructions. If you get here and somebody else is here, you'll know by the cars in the parking lot. Everybody knows my car, and then they'll know if there's other patients here. Just wait in your car until the patient before you leaves, and then come in. I wear a mask and gloves with all my patients. I do my best that I can to disinfect, my phlebotomy chair where they sit, the area that they come in contact with, things like that between patients. They come in the front door through the waiting room, and they come into my phlebotomy area, and then I have them exit out of a back door, so they don't have to go back through the waiting room in case there is the next patient out there. Because on a small island, everybody knows everybody, so if they go back through the waiting room, they're like, "Hey Mary, how you doing?" Then they get talking about the virus, and then they're there for a half hour chatting. And I'm trying to get patients in and out as quickly as possible with the least contact or exposure to other patients that are here. And I offer them the ability to put a mask on themselves if they come in the door. I have a little table there with gloves, masks, of course, Purell's all over the clinic here. And it was interesting. This morning was really interesting because our governor and, of course, the US CDC has just kind of made a strong urging for patients to wear masks now, or everybody, the public, to wear masks now. A couple of my patients came in this morning with their own masks, which I was delighted to see. My community is a little behind the curve in social distancing because we're so isolated anyway that they kind of feel like we're safe out here. Well, we're really not, but we'll catch up with what everybody else is doing in Boston, New York, and places like that eventually. So I have a limited supply of masks. However, I do offer them to my patients if they would feel better putting mask on themselves. Like I said, I have my mask on, and I don't take it off until they're out. If there's no patients in the building, I'll take it off. But if there's still patients in the building, I continue to wear my mask. So it was interesting to see, who chose to wear a mask, who had their own mask. And, I had a maternity patient this morning, and she has to go to the mainland for a reason. And I said, do you have a mask to wear on the mainland? She said, I do not. And even though I have a limited supply, I felt that here she is, 6 months pregnant. I'm going to give her one of my masks. I said, do you have gloves? No, I don't have any gloves. So I gave her 2 pairs of gloves that she could use, because I may run out of gloves and I may run out of masks, but in this instance, I feel that her protection is worth it for me to give some of my resources away. I can't give a mask to everybody on the island, but to like higher risk patients, I think I could share. One man that put a mask on when he came in, I said, well, you can just drop that in the trash can by the door on your way out. He's like, can I keep it so I can use it again? I'm like, absolutely. I go, I said, they're single-use masks, but, it's better than nothing. So I said, sure, you can take that mask home with you if you want to. So I'm doing phlebotomy on Tuesday mornings, and I'm also doing telemedicine, video conferencing medical visits with mainland providers. We have had a unit here, a telemedicine unit here for probably 10 years, I would say. And we use it for behavioral health counseling. We use it for primary care. Things like that. So Thursday this week, I have 6 patients scheduled back to back to back on starting Thursday morning at 8:30 for telemedicine appointments with the same doctor on the mainland that particular day. So, as people need those kind of appointments, my feeling is that just because we're in the middle of this pandemic doesn't mean patients don't still need routine medical care or acute care if something comes up that's unrelated to the virus. We have no cases of the virus on the island currently, and we only have 2 cases in the county where I live right now. But more will happen, I'm sure, as time goes by. And then this week I have a foot doctor coming, and there was kind of a real struggle about that. Should he come? Shouldn't he come? Should he come? Shouldn't he come? So I spoke to him and I said, are you willing to wear a mask with all patients? Absolutely, he said. And he's been coming here for 13 years. And I said, let me call each one of your patients up and ask them if they would be willing to come and see you should you come out. So I called all of his patients, and there were only 2 that said no, they wouldn't be willing to come to be seen. Everyone else said yes. And nobody really hesitated either. I said, the doctor will have a mask on, he'll have gloves on. I said, I will, if you want to wear a mask, it'll be on the table right inside the door. You put the mask on. And one lady said, I don't think I can wear a mask. And I said, why not? And she doesn't have any breathing difficulty or anything. I just don't think I can do it. I said, you know what, when you come in, pick up the mask and put it on. I said, it's not as hard as you think. And I think what has happened about the mask wearing is we're just not used to putting something like that over our face. And it feels funny and it looks funny. And until we see our neighbors all wearing masks, then it'll catch on. Like I've been wearing a mask on the island for 2 weeks, because of my situation. I'm now considered to be a stage 4 patient because of the spread of the cancer to my chest recently. So, if I go in the post office, I wear a mask. If I go to the store, I get curbside. We have a small store. I get curbside pickup of my grocery order, but I get out of my car with my mask on. And I think that one of the reasons I decided to do that early on was to protect myself, my own health. But I thought if people see me wearing a mask, maybe they'll be like, hey, Donna's wearing a mask. And maybe they'll even go so far as say, hey, Donna's wearing a mask and she's really smart. Maybe I should wear a mask. I don't know. But, you lead by example, I guess, and so I'm hoping that more of my neighbors will do it. And I have a couple ladies that are making, cloth masks now that are sewing up a storm out here. And, we're going to be distributing those masks to anybody that wants one. And of course, there's many things online where you can make your own mask out of, old t-shirts or handkerchief or whatever. So hopefully it'll catch on and we'll see more masks around the island in the near future.
So kind of in wrapping it up, you mentioned a little bit about, you still think acute care should still be provided. So someone might have that question. For someone who does have that question, what's the driving force behind keeping the center open and even you as a patient with cancer staying in that environment? What's your driving force?
So I would say I've given this a lot of thought about my own risk to stay working because this is entirely my decision. My town is governed by 3 selectmen, a board of selectmen, and they could close the clinic if they wanted to. They could just come in and say, Donna, we think the risk is too great. We want the clinic closed. And they may do that at some point. I don't know. Other island communities have done that. I've heard that already. And my reason for keeping the clinic open is I have been serving this population for 13 years. This is my 13th year here in my role at the health center. I recognize that we need health services that other communities have readily available to them. If people lived on the mainland, you've got dentists, doctors, chiropractic care. You've got everything you need, within a couple miles of where you live. We don't have those things here. So what we have is very minimal to begin with. And when I think of my neighbors having to travel to the mainland, especially my elderly neighbors having to travel to the mainland, they're in that high risk, vulnerable category of patients that may not fare so well if they contract the virus, the COVID-19. And I feel like it's my job in this role that I'm in to help protect them as well as protect myself. And I think I've taken a lot of measures here that I would not be normally doing. I wouldn't be wearing a mask at work every day. I wouldn't be doing that, things like that. I wouldn't be aggressively disinfecting between every patient that sat in my chair. I would be doing that at the end of the day, that kind of stuff, things like that. So I think my reasoning is I feel that my community has come to depend on me over all these years. And I don't want to let them down, I guess. I don't want to make things harder for them. This is a really hard time that we're in right now. And if they don't continue to get, routine care, I think some of them would not go to the mainland because the doctor's offices don't want you coming in person. The hospital certainly doesn't want you showing up to get your cholesterol tested. They're dealing with bigger things right now. But this level of patient care needs to continue. And a lot of my patients come in here and they're on blood thinners, like Coumadin. And, if they don't come here and they get a finger stick test for that particular test. If they don't come here and get that test done, they're probably not going to go to the mainland. And if their medication level gets off, either too high or too low, they could run into some serious problems, stroke, heart attack, things like that. So it's really important for those people to be monitored, on a monthly basis or every 2 weeks, depending on where their levels are. And I just can't see putting that burden on my patients. I guess that's why I've continued to come to work every day. And as long as I think the risk is minimal, which I believe it is now, I'm fine with that. What would probably cause me to shut the door and not come to work would be if we have a couple cases of COVID-19 on the island. We're such a close-knit community. I fear it would spread very rapidly through my community. And then I wouldn't know. And I have to assume everybody that I encounter could be, asymptomatic and could be spreading the virus anyway. But once you know of confirmed cases, that really escalates your concern level greatly. So I think that would be the thing that would make me say, okay, I'm done for the duration until things get better.